Disclosures for this and all episodes in this series can be found on the podcast series destination page located on education.webmd.com. The following presentation is copyrighted by WebMD Education. No use, broadcast, or recording of this presentation or any part thereof is permitted without the written authorization of WebMD Education.
The following podcast is supported by an independent educational grant from Novo Nordisk.
Hi, my name is Donna Ryan, and I'm Professor Emerita at the Pennington Biomedical Research Center in Baton Rouge, Louisiana. Welcome to this podcast episode, Tips for Bringing Weight Loss Up with Your Doctor. This is part of a 6-episode podcast series called Finding the Weight Loss Plan for You. Today, I'm speaking with a patient, Jeremy, and he's going to share with us his weight loss journey and how he found his current doctor. Jeremy, I think everybody's story is different around weight, how they gain weight and also how they lose weight. Can you tell us a little bit about your journey so far?
Thanks for having me, Dr. Ryan. I grew up in the Northeast, but with a Texas mom who would overfeed me that good, rich Texas food. And she herself had gone from being very thin to being very fat. In fact, it was a family trait, seemed to be genetic. Almost all the women in my family got up to 300 pounds. So I was a fat kid and I suffered from all the problems, people making fun of me and seeing it as my weakness. And so when I was 12, I was determined to lose weight. I was always able to lose a little weight and then I would always gain it back because my body would get the better of me. But at the time, I didn't know that's what it was. I thought I just didn't have enough willpower to keep it off. As I got older, I would lose weight, but then gain back more than I'd lost. I think I've probably lost 50 to 100 pounds 10 times in my life. It would just keep going up and down and up and down. In that process, I've tried just about every fad diet and medical diet that I could find. And in the past few years, I started getting other weight-related problems like diabetes, heart disease, and GI issues. Basically, though, my life has really revolved around losing weight, trying to keep it off, putting it back on, and dealing with the negative social aspects of being overweight and the ways that people treat you.
Jeremy, this story is so typical. I have people in my family who have had this same experience. You know, I think we underestimate how important genetics is in our susceptibility to gaining excess weight. It's very important, and your story illustrates that. Your story also illustrates self-blame. You know, obesity not just affects our metabolic state and our functional state, it also affects our mental state. So I have great empathy for what you've been through, and I know many, many people exactly like you. But as I said, everybody's a little different. You said you've tried everything under the sun to lose weight, but the weight keeps coming back. Did you ever go to a doctor and seek medical treatment for obesity?
I did. After trying lots of diets on my own or with my family, in the 1990s, I sought medical treatment, which back then was mainly medical shakes and meal replacements, some of which were really awful, but I ate them anyway. And I did lose some weight, but I couldn't stay with it. In 2006, I enrolled in a medical weight program at a local hospital that was really quite good. And it helped me lose a lot of weight, probably 60 or 70 pounds. And that's when I was also doing a lot of cycling and other exercising. But unfortunately, and as usual, the weight eventually came back after about a year when I couldn't keep up over exercising and under eating. Then about 5 years ago, I tried a medicine I had to take by injection. And at that time, it didn't work for me because I had other medical problems going on and it irritated my pancreas. Then most recently, I had surgery to remove my gallbladder because of gallstones, which were irritating my pancreas. And I've had several doctors in the hospital saying, you really need to lose weight and you should consider bariatric surgery.
You know, Jeremy, losing weight increases the risk for gallbladder disease. And you're lucky in a way that you have gallstone pancreatitis because that's something that we can treat once the gallbladder and gallstones are taken out. You don't really get inflammation of the pancreas anymore, and that's a very good thing. But let me go back to your comment about being advised that you should consider bariatric surgery. Had you ever thought about this on your own? And what was your reaction when the doctor said this to you?
Well, it's something that I'd considered from afar most of my life. But this time I decided I would take the suggestion really seriously. So I did a lot more research. I went to the local hospital and signed up for their bariatric plan so I could go through the program of being evaluated by all their doctors and psychologists and go to a couple of support groups. And I also started speaking with people that I knew, friends who had it and loved bariatric surgery, been very successful, and seemed to have a way of working with it. And then I found a number of other people who weren't happy because they had gained the weight back or they experienced a lot of negative side effects. And because of my tendency to always get the odd side effect, I thought, this just may not be the right thing for me.
So, Jeremy, you decided to take an approach, medical management of weight loss. So, how did you go about finding a doctor?
Well, the bariatric program I was working with had just hired a new person who I found to be really receptive. So I spoke with her and learned that she was certified in obesity medicine, and she understood so much about what I'd been through and what the multiple causes are and how it's really a disease and hormonal and your body can get the better of you. And it has very little to do with willpower or laziness or gluttony. And she was courageous enough to say, let's try a new formulation of that injectable medicine that's available. My gallbladder surgeon had also said, now that your gallbladder's out, you probably won't get the pancreatic inflammation. Most of my other doctors were not courageous enough to try it after my experiences before, but luckily my new obesity doctor said, I think we should try it and just monitor everything very closely. And glory, hallelujah, it's starting to work and it didn't irritate my pancreas. I loved her whole approach. We had a lot of really good talks and I appreciated more and more the depth of her knowledge and experience.
It's so important for patients like you to get to a doctor who knows something about obesity. So I want to explore a little bit more about how she was different from your other experiences with doctors. How did she interact with you and what was different about her technique compared to other doctors?
Other doctors who were not in the obesity field would basically just say things like, you should lose weight, just cut out sugar and white bread, or eat less and exercise more, because they really didn't know much more about it than that. And that was something that worked for a lot of their patients. So that's what they would say. But they never really got into the details of how the hormone system works and how the body processes things when it tends towards obesity. And it was actually from the bariatric surgeon that I learned about how certain hormones will get the better of you. And that's one reason they recommend the surgery, is because they can cut out the areas that generate some of those hormones. I still wasn't ready to get the surgery, but it was really enlightening to learn about all those things. And, it would explain why after I lost weight, my body would just keep asking for more and more until I gained it back. My obesity medicine doctor explained that obesity is multifaceted. It doesn't have a single cause, and that all those different facets can be treated with different methods, which includes medicines. And then my nutritionist, who's part of that same bariatric program, was great, because even though I wasn't going to have to be eating the bariatric surgery diet, he was very skilled in discussing how I should add certain foods rather than just trying to cut things out, and would send me to specific foods at specific stores that turned out to be really good. And it's really quite a surprise that you can eat more, and if it's the right things, then your system is more balanced than if you just try and starve yourself.
You know, Jeremy, so many patients who have obesity have not seen a registered dietitian. It's really important that we improve the quality of our diet, even if we're not losing a lot of weight. But one thing you said I want to highlight, and you were talking about how bariatric surgery worked. You know, it's not just making the stomach smaller. It does have effects on the biology of the hormones in the gut that help regulate hunger and food intake. So it very much has a biologic effect. In fact, we've learned so much from bariatric surgery and have been able to identify medication approaches. What advice do you have for the people listening to this podcast about how to go about finding a doctor who's knowledgeable, like your own doctor?
Well, I think for many people, they just don't know there's doctors who specialize in obesity. They may have heard of the surgery, but they don't know about people who specialize in medical treatment or nutritional treatment. And they may just go to their family doctor or a doctor who's convenient to ask about what they can do to lose weight. And that's usually not successful if they have a real problem with obesity. So I would say if your doctor doesn't have that training, ask them to refer you to a specialist and a nutritionist. It's so important to try and find the right supportive environment with somebody who's knowledgeable, knows how to treat the disease, and is comfortable talking about all the details. And it's ideally somebody who's certified in obesity medicine, or at least has taken some separate training or done research in obesity medicine, because one of the things I found talking to my regular doctors is they say that's one thing they just don't focus on in medical school.
So, Jeremy, is your visit to your doctor who's now helping you manage your weight, is that a one-off thing, or did you just see him for 6 months or so? How long do you expect to be followed by this doctor?
Well, if the injectable medicine works, that's something I should just stay on. And I am in touch with that doctor by text through the portal, probably, every 2 or 3 weeks. And then I see her either in person or in a video visit every couple of months. So I think that follow-up is incredibly important. And I'm lucky that the hospital where she is, all the doctors there, particularly the surgeons, are really good at following up with their patients and seeing how they're doing. Because whenever you have surgery or a chronic condition like this, you really need to develop a lifelong relationship with your doctor. And it's not fast food.
Yeah, it's a long-term relationship. That's very true. Now, let me ask you about this. You took charge of your weight loss journey from a young age, but I think many people are uncomfortable bringing up the subject of their weight. What advice would you give to a person who's uncomfortable with bringing up this issue about their weight with their doctor?
Well, it's important to tell your doctor, whatever their specialty, whoever the person is that you feel closest to and who's most receptive, that you don't feel comfortable about it. And maybe you're not even really sure you want to commit to a weight loss program, but it's something that you want to look into. And it's important to know that it doesn't make you a bad person if you say you're uncertain and you haven't succeeded. It's not something where you have to come in with the solution, and you may not get the solution from them, but just laying the groundwork for that discussion is very valuable. And I found that every time I talk to a good doctor about things like this, I learned something that I didn't know before. It may not be the key to success, but it's a little detail that's another brick in the wall of figuring out how to solve the problem.
I agree, but it's time to wrap up. Jeremy, do you have any last thoughts that you want to share with the audience?
Well, I'd just like to say again, I'm so appreciative of the chance to talk about this because I think it's very helpful for people to hear from somebody else who's tried a lot of things and who's finally found weight loss doctors that they can consult with, and something I wish I'd known about many years ago. So I'm just happy to be able to share that information, and I hope it helps somebody.
Jeremy, I want to thank you for that. And I want to add something. You said that you learned something from your doctors at every visit. Well, I learned something from every patient. So I want to thank you for sharing your story with us. Thank you for joining us today, and thanks to our listeners as well.
Thank you.